Hi, my name is Dr. Peter Ting. I'm a cardiologist and I treat a broad range of cardiac conditions such as coronary artery disease, cardiomyopathy and heart failure, and valvular heart disorders. But I have special interests in using lifestyle medicine to treat the risk factors for heart disease to help reverse heart diseases as well as some chronic conditions. Some of these risk factors are well known to everybody. They include hypertension, diabetes, um, high cholesterol, lack of physical activity, poor diets, poor sleep or a high amount of stress, excessive alcohol, smoking, and obesity. Now, you might ask why a cardiologist like me is interested in obesity. Actually, obesity is linked to many chronic conditions, particularly the heart. Being overweight, particularly having central obesity or fat around the waist area, actually leads to metabolic complications and inflammation that may directly as well as indirectly affect heart conditions. Directly, it can put excessive strain on the heart when the heart has to beat harder because of the increased weight. And indirectly, obesity or central obesity can lead to chronic conditions such as hypertension, high cholesterol, diabetes, or obstructive sleep apnea, all of which can impact the health of the body, in particular the heart. So my advice for anyone who might be a little bit overweight or even obese, particularly if they have a family history of chronic diseases such as diabetes or even heart disease, and if they're already showing some evidence of metabolic dysfunction such as high cholesterols, high triglyceride, abnormally high blood sugar, or even a high blood pressure, they should really start looking at how they can manage their weight better by looking at the way they exercise or eat. And they should also think about having their heart as well as blood vessel health checked at an earlier stage so that we can start instituting preventive measures, ideally without medication, at an earlier stage. In particular, people who are overweight or obese should be even more alert for symptoms of underlying heart conditions. And these may include chest pain or chest discomfort. Sometimes they may not have typical chest discomfort, but just have discomfort around the jaw or neck area or the left shoulder. If a person feels out of breath or that is out of the ordinary, or they feel tired or fatigued, or they have irregular heartbeat or palpitations, or they start to feel a little bit dizzy or more dizzy, they should also think about having their health checked out, in particular the heart. Definitely, most of us can start exercising a whole lot more and also eating better. The modern diet that we're used to is very high in saturated fat as well as refined carbohydrates, and all this can very easily lead to weight gain and finally obesity as well as a lot of chronic conditions. I think we should all take simple steps to start exercising more regularly if we are not already, as well as paying a little bit of attention to how we eat, increasing foods that are known to have benefit for our health, such as high fiber foods, vegetables, fruits, as well as whole grains, and reducing saturated fat, red meat, processed foods in particular, as well as refined carbohydrates such as sugar and sweets. I'd like to share with everyone that coronary artery disease, which is a blockage of the coronary vessels, can actually be treated in most cases without stenting procedures or surgical procedures. You might want to consider whether you are suitable for lifestyle medicine therapy as well as medical therapy, which consists of some medication as well as personalized lifestyle modification in order to help treat and reverse existing blockages in the arteries. This can be done successfully in many cases, but of course, an individualized assessment is required to see the suitability as well as the safety of a particular patient with coronary heart disease blockages on whether they can start this type of treatment.